There's enough events occurring locally, nationally, and internationally that really call for this kind of preparedness, and that's what's driving us right now.
The Vancouver Police Department, Vancouver Fire Rescue Services, BC Emergency Health Services, and E-Comm have all teamed up to develop a new joint rescue task force, changing the way they respond to active deadly threat situations.
The difficulties before were getting prompt medical aid and pre-hospital care to patients before they suffered life-threatening injuries or bled out because of their injuries.
So far, more than 700 police officers and 400 firefighters have received the training which coordinates the various first responders during active deadly threat situations.
With this new model, our rescue task force, the police will continue to assume responsibility for addressing active deadly threats, but we will now work with our firefighters to stabilize and extract wounded people to designated points where our partners from BCEHS can do what they do best: treat and transport. The term active deadly threat refers to an assailant who is actively engaged in trying to kill innocent people with a weapon. That weapon could be a gun, knife, vehicle, or anything else that can be used to hurt people.
In the past, EHS and fire had to wait for an all clear before entering a scene, and the longer they waited, the less likely a patient would survive.
By getting our staff in with the help of VPD to quickly assess and extricate and do rapid treatment on those that have suffered critical wounds and extricate them to a point that's safe where BC Ambulance can provide a higher level of care and then obviously transport them to hospital.
Task force training began last fall and will be ongoing.
Any implication that initiatives like Rescue Task Force are fear-mongering or addressing a non-existent threat fail to recognize the reality of modern public safety thinking.
In Vancouver, Ashley Burr, City News.